my name is Arlene. I'm going to be performing a physical exam on an infant. This is baby Ellie. Baby Ellie is 1 week old. She was born to a 30-year-old primigravida mom at term delivery. She was 37 weeks and it was a vaginal delivery. Again, mother was gravida 1. This is her first child, so para 1. No previous abortions, and this is her only living child. Mother states that the baby was 3.4 kilograms at birth and 19 inches height, so about 28.6 centimeters length. Mother also stated in the history that she had an uncomplicated pregnancy, that she was registered at the time of delivery, that she started prenatal care at about 8 weeks. She did take multivitamins daily. She was denies any history of hypertension, diabetes, thyroid problems. She also denies any history of smoking, drinking, alcohol use. Her GBS was negative. She also states that she had her immunizations, the Tdap, COVID, and flu shots. After the baby was born, again, it was a vaginal delivery. Baby didn't have any jaundice. The APGAR scores were 8 at the 1 minute mark, and then 10 at the 5 minute mark. The dad was present at the time of delivery. She didn't have any issues with breastfeeding. She breastfed within the hour. She didn't have any issues stooling. And she did have her hepatitis B vaccine and her vitamin K vaccine before she left the hospital. So now I'm going to go ahead and proceed with my head to toe exam. So first we start with the level of consciousness. And baby Ellie is quiet alert. So because she is quiet at this point, I'm going to start with the auscultation of the heart and also listen to her lung sounds. And with the heart sounds, we would listen to them for the apical pulse for 1 full minute. I'm not going to do it in this video, but just we would have to do it in one whole minute with the bell of the stethoscope. So her heart rate is about 140 beats per minute, which is normal. I would also proceed with examining the lung sounds. So I would start on the sides. Sometimes with babies, because the heart is much larger, it's harder to listen to the lung sounds. But baby Ellie's heart sounds are clear. And at this point, I can also assess the abdomen, so in all 4 quadrants. And bowel sounds are present in all 4 quadrants. I would also assess the brachial artery pulse here. And they're present. And I can also do at this point, since I'm here, assess for a palmar grasp. Okay, so baby's grasp reflex is present. And then now, since I did my heart and lung sounds, her respiratory rate was about 40 beats per minute. And again, for heart and lung sounds, it has to be for a full minute because sometimes the baby can have periods of apnea. And we will reserve the temperature towards the end because babies typically don't like their temperature taken. So now I could go ahead and proceed with my head to toe exam. So I would assess the head size and shape. So the baby's shape is round. I'll check for the anterior and the posterior fontanelles, make sure they're not sunken or bulging. And I would also measure the head circumference at this point. And the mom did report that the head circumference was about 35 centimeters at birth. And so right now it's saying it's about 38 centimeters. And again, the head is should be bigger than the chest. Okay, so now that we took a look at the head, I would check for the red reflex, the baby's eyes, and again look at the sclera. So red reflex is present. Absent can indicate things such as neuroblastoma. And I would look at the baby's skin, checking for a jaundice or cyanosis. And I would also look that the outer canthi of the of the eye is kind of symmetrical along the same line as the pinna of the ear. So check both ears, and then I would go and examine the nose, and I would check for the patency of both nares, gently squeezing both nares, making sure that the respirations are not compromised. And then also checking the baby's rooting reflex. The baby would turn, and then I would, with the glove, I would examine the baby's mouth and check for the soft and hard palates, and also at the same time could assess the sucking reflex. And then going down, I would take a look at the neck, and looking for webbing, and at the same time I could do the tonic asymmetrical tonic neck reflex. So in this reflex, if you turn the head to the side, the baby's on this side it should be flexing, and then this side would be extending, kind of like in a fencing position. So continuing down, I would measure the baby's chest circumference, and again the baby, this would be in centimeters, and again the head will be bigger than the chest. So the head was like 37 centimeters, so we'll say that the chest was 35 centimeters. And again, we would go down and look at the umbilical cord, making sure that there is no redness, edema, any drainage. And then we could go down. Once a baby is exposed, we would assess the femoral pulses, and also so they're strong, they're present, and then we would assess the genitalia. So if a girl, we would look for like baby Ellie, the labia majora and the labia minora. If it was a boy, we would assess the testicles, that they're descended, that their urethra is present, there's no epispadias or hypospadias. And again, we would look at the tone of the baby, making sure they usually are like in a flex position, and they're not flaccid. So we want to check for the tone, and also range of motion of all the extremities. So baby Ellie has good range of motion. We would also check for hip dysplasia, and with this we would do two maneuvers, the Barlow and Ortolani. So the Barlow, we would put the legs out or adduct, and then abduct, sorry, and then we would bring them back in and gently pressure around the knee, and we shouldn't hear any popping in the Ortolani maneuver. And again, go back, and so there's no popping, so there's no evidence of hip dysplasia. Again, we would go down and assess the plantar grasp reflex, and baby Ellie has present. Also look for the Binsky reflex, and the toes should fan out. And then as we continue with our exam, I would test for the Moro reflex. So with the Moro reflex, if we slightly have baby Ellie's head down, she would typically get startled, and her legs and arms would extend out, and that would be the Moro reflex. Okay, now if we turn the baby Ellie to the back, we would examine baby Ellie's head again, and then we would examine her spine, so making sure that it's straight, and we would palpate it and make sure that there's no curvatures. Usually it's like a C spine, and we would also check for any sacral dimples, making sure that there shouldn't be any. And then with the baby exposed, we can also check for any of the gluteal folds, that they're symmetrical. And and then at the very end, we would check for the baby's temperature, and we want to take an auxiliary temperature, and her temperature is within normal limits. It's 36.5 degrees Celsius. So this concludes the end of my exam for baby Ellie. Thank you.